In today's video, we're going to be using the Kenhub website to learn one of the coolest muscles in the entire human body, the trapezius. So the goal is obviously going to be to learn the anatomy of the trapezius muscle in today's video, but to do that, we're going to be using one of Kenhub's 100% free articles. And if you've never seen our articles before, these are going to be free, and they're basically modeled after an anatomical encyclopedia. So what we do is assemble a whole lot of information for you, make it very convenient for you to extract the need-to-know information. So if you look at the beginning of each of our articles, you're going to see these key facts tables, which just like assembles, again, all the need-to-know information. So for trapezius, you can see our origin, the insertion, the innervation, and even the blood supply, all packed right here for you, which is awesome. But these articles are also going to contain 100% free atlas images. And that's what we're going to be using to test, or rather learn and then test our knowledge on the trapezius. But there is a lot more in these articles. I strongly encourage you to go follow along with me as I'm going through this. But let's jump on up to this image of the trapezius and get right into it, because the trapezius is a massive muscle. It's a back muscle, even though it doesn't move only the back. It's actually more primarily considered a limb muscle, an upper limb muscle, to be specific. But it is going to move the head and neck. But look at this thing. This thing is huge. It swings down from the head, comes all the way over to the shoulder, and then it's going down to your mid-back. So this is going to be T12, and we'll get there in a second. But this is spanning basically from your head all the way down to the end of your rib cage. That is a huge muscle, which also means that it's going to have some pretty hefty attachment sites and numerous functions. So what I want to do is break it down into its three components. So we have what's called the descending part, the horizontal or transverse part, and then the ascending part. And so it's basically just following the fiber orientation. And this is one of my biggest tips or tricks to understanding muscles, is whenever you're looking at a muscle, instead of trying to just brute force memorize it, you want to just look at the fiber orientation and play this mental gymnastics game of just bringing point A and point B closer together. So like, for example, if you were to imagine these fibers contracting, what would that likely do? And as you go through that exercise, you'd probably be surprised, or maybe not, how often you are correct. Because a lot of this is very intuitive. And that, to me, I think is one of the best and simplest ways to learn your muscle anatomy, instead of just relying on memorization, is very practically and in using your imagination, just working through the functions of those muscles. So let's see here. Let's now that we have an idea of the trapezius, I want to look at its attachment site. So we're going to scan down here to these images, and what we see is in green is going to be the attachment sites. So this right here is what's called the superior nuchal line. Now, trapezius doesn't attach to the entire thing. It really only attaches to about like right here. So what is that? It's like the medial, I think it's the medial 1/3 is the most specific way we could say that. Oftentimes I'll just tell my students it's the nuchal line. Kind of depends on how in-depth your anatomy program wants, but if we are being highly specific, it's the medial 1/3 of this nuchal line. So this is basically just like this ridge line in the back of your head. So if you kind of cup the back of your head and slide down, you're going to see like it's going to start sloping. That is where you're getting to what's known as the occipital ridge. So the occipital ridge is like this whole thing right here. And if you just go a little bit above that, you're also going to see this bump. As I come over, I want you to feel the bump. This is probably the easiest way to find the nuchal line. This bump in the back of your head is called the external occipital protuberance, which basically just means a bump on the occipital bone, which is this massive bone in the back, and it's a protuberance, so it's like a pokey outy thing. That's basically what that means. And trapezius is going to attach to it. So if you feel for that external occipital protuberance and then kind of just slide maybe like one knuckle distance to the side, then you are feeling the medial 1/3 of that superior nuchal line. And that is where trapezius is attaching. And another interesting, I guess, hack, if you will, of trying to find trapezius is if you just like put tension in your neck, you can kind of feel there's going to be this tissue that goes up to that external occipital protuberance, and you can kind of pinch it, and you are feeling what's going to be called the nuchal ligament. So I'm actually going to skip this for a second. I want to show you this. This is what's known as the nuchal ligament or the ligamentum nuchae. And as you can see, it goes up and attaches to that external occipital protuberance. So this is kind of like the piece of tissue that, like, think like a cat. Like if you grab a cat by the scruff of their neck, you're essentially grabbing their nuchal ligament, as well as a lot of integument and other things. But you are essentially grabbing it, and so this is a very strong piece of tissue. And so you can use that to help orient yourself and find the trapezius on your own body as it leads up to the external occipital protuberance. Now, since we're here, let's just talk about the nuchal ligament, because the nuchal ligament is going to also attach to the spinous processes of these bones here. So these bones are the cervical vertebrae. So a vertebra is simply a backbone. And then we divide it based on its region. So if it's in the neck, we call that the cervical vertebrae. If it's in the chest, we call those the thoracic. And then if it's in the low back or the abdomen, we're going to call those the lumbar vertebrae. And there are 7 cervical vertebrae inside of your neck. And this posterior most portion of it is what's called a spinous process. In fact, this isn't a cervical vertebra. This is a thoracic vertebra. But I think this will help illustrate the point. There is this projection coming off of it in the back. So this really thickened portion is what we call the vertebral body. This is like the weight-bearing part of the bone. But if I flip it to the other side, there's this pokey thing on the back. And this is what you can feel on your own. If you like go to the very midline of your back, you're going to feel all these little ridge lines. It's almost like speed bumps going down your back. This is what's called the spinous process. And in fact, this is likely why people refer to the entire vertebral column as the spine, even though that is not accurate, because there are many spines. A spine is essentially just a projection. And so this is the spinous process of a vertebra, but there's spines all over the place. Like to give you a quick example, I have a scapula here as well. This right here, this whole thing is called the spine of the scapula. So to say like your back is the spine is not technically accurate. It's better to say the vertebral column. Well, trapezius attaches to these spinous processes of C1 through C6, and it'll even come down to C7, but it does that via the nuchal ligament. So the nuchal ligament is this really dense piece of connective tissue. And what you're not getting from this particular view is that, like, if you could turn the head to the side, this actually has depth and width to it. So you could literally think like a sheet of connective tissue just going from the back of your neck, all like the back of the skin, essentially, all the way towards those spinous processes. And the nuchal ligament for most animals in the world is there to help keep their head up. Right? I want you to think like a horse. If a horse was, just having to continually contract its muscles to keep its head up, that would be exhausting. I don't know how much a horse head weighs, but it's probably a lot. So what they have is a nuchal ligament that can help to keep it taut, and so they don't have to rely on the musculature and ATP expenditure basically to keep that up. Well, you don't need that, right? We are bipedal as humans. We walk on 2 feet, gravity flows through us. It's like, why do we have a nuchal ligament still? Well, partially because trapezius grows out of it, and also because the nuchal ligament helps to keep your head straight as you are walking and running. Because if you are walking and running, let's just say you're running, right? Let's say you're chasing somebody down. There's a lot of energy transfer from side to side. And as that's happening, it's just going throughout your entire body. If you didn't have the nuchal ligament to help keep your head straight, it would be like this, right? Which is ridiculous, right? The nuchal ligament is there to help keep your head straight. And so what'll happen is energy comes up into your body. It's going to just kind of stop here and just hold the head in line, and it's easier for when you're running and just trying to keep eyes on something. So the nuchal ligament is also going to be one of our attachment sites. Then if we come down here, you can see we have a posterior view of the rib cage and back. And so we can see up here, this is C7. Now, how I know this is C7 is because there's no rib attaching to it. Right? The ribs only attach to the thoracic vertebrae. So this is T1, because you can see the very first rib coming around. And then we also have T12, because you can see the very last rib, which means there are 12 ribs and there are 12 thoracic vertebrae. And sure enough, what we could say is that the trapezius also originates on the spinous processes of C7 all the way down through T12. So if you really add it up, it's kind of like you really could say that it originates on the spinous processes of C1 all the way down to T12, because it is attaching there in the neck. It's just doing that via a tissue called the nuchal ligament. But regardless, how we would more properly say it is C7 all the way down through T12. But that's just the origin, right? This is a massive muscle, remember. This thing is spanning like the entire back. So if we want to see, go back here, if we want to see its insertions, right? So let's come back down and click on this image here. What we can see is this posterior view of the skeleton. And there, if we look at this little highlighted portion here, this is called the spine of the scapula. And I already showed you this. So this is a scapula. This is a right scapula. And this posterior ridge line is called the spine. And what happens is trapezius will come over and attach to that spine of the scapula. So it attaches to like the crest of it up here. But then what it's going to do is it's going to come over and attach to this bone here called the acromion. And that's this flat portion. So the acromion means peak of the shoulder. And you can feel this on yourself. So if you come over with, use your opposite hand, feel your shoulder, you're going to feel like there's this bone up top. But if you really want to find the acromion, all you got to do is kind of like you're doing like a chicken wing position. And as you do that of the shoulders, you're going to feel a divot forming. That is where, I don't know if I have a clavicle. I might have a clavicle. Hold, please. I have a clavicle. So this is the collarbone. So, which it's not the right side. I'm gonna make do with what I got. This genuinely wasn't planned. So what's gonna happen is the clavicle is meeting. So here's the clavicle is meeting with that acromion. And then when you are doing that chicken wing position, you are moving the clavicle like this, and that's the divot you're feeling, is this basically the movement between what we call the acromioclavicular joint. So that's a way for you to find it. But since I have the clavicle here, we can also see that trapezius swings around and attaches to the lateral 1/3 of the clavicle. So the clavicle is a pretty massive, well, I shouldn't say the massive bone, but it spans a good distance. It seems pretty small, but it spans a good distance of your chest. But that lateral third of it is where the trapezius is going to insert. And so if you were able to add all of this up, so again, this is the wrong side, but I'll make do. It forms, I'm going to see if I can do this. Let's see here. I'm going to go like this. This is hard to do. I don't know if this is going to work. This probably isn't going to work. But it's supposed to form a horseshoe shape. So basically, the insertion is going to come from this lateral third. And then it's going to swing around again to the spine of the scapula and the acromion. And so, this is a good image for it. So basically, if you imagine this, like it's forming this horseshoe shape. This horseshoe shape just like that, which is pretty cool. And what's also interesting is we're not going to discuss it in this video in any more depth than what I'm about to say. You also have the deltoid muscle, the shoulder cap, coming off from that exact same place. So what'll happen is trapezius will insert here, but deltoid will originate in those exact same locations and then come down to the middle of the humerus. Pretty cool. So now that we understand the attachment sites of trapezius, let's see if we can figure out some of the functions of this muscle. And there are numerous functions here. So let's break it down section by section, and we're going to use our imagination. And I know that might sound a little strange, like why are you using your imagination? Well, I think this is one of the easiest ways to really learn your muscles is to build your intuition around how they work. And so what I mean here is if you can just simply picture what happens between points A and point B if they get closer together, then you can start to picture the muscles' functions on your own. And this is honestly how I know my muscles. I have done very little memorization in my anatomy career. Most of my time spent with muscles has been just picturing it and watching the muscles contract. I tell this openly to my students many of the times when I'm lecturing, where I still do not always know the functions of some muscles until I look at them. And that's just because there's so much anatomy, and I think there's only so much space in the head, and I'm sure you're encountering this right now in an anatomy class, that, sometimes there's certain information I'm like, maybe I'm not going to hold on to that because I can also, though, picture the muscle. So if I can picture the muscle and then cause it to contract, it's a little bit easier to figure out the function. But enough of that. I want to show you exactly what we mean here. So let's look at the descending part of trapezius. So descending is coming from that medial aspect of the nuchal line, the external occipital protuberance, and from the nuchal ligament. And what it's doing is it's swinging down like this. Now, since it's attached to the head and neck, this is going to perform some extension of the head and neck. So this is like bringing your head and neck back. Now, quick aside here, now this seems very uncomfortable, and yet we do this all the time, except you're used to seeing it more like this, which is just an interesting little thing to think about, that you are using your trapezius in a way that is probably not the best for your neck most of the time, but still. So we are going to have some extension of the head and neck, but if we are also looking at what it's doing to the shoulder here. So when we're looking at the shoulder, specifically the scapula, what's happening is this is going to be able to elevate the scapula. And I want you to think to shrugs, right? Like, I think most people can intuitively know that the shrug motion is going to help work out the trapezius muscle. And in fact, when I was growing up, I used to think that trapezius was only this area right here. I had no idea it was as big as it actually is. And so the shrugs are very intuitive, and what's going to happen is it's the descending part of trapezius here that is going to elevate the scapula into that shrug. And so what we can also see is it'll also like contract to lower it down slowly if you're kind of like dragging it down. But if you're also just like dropping them, it can even just let go and kind of like literally drop the shoulder and the scapula into that position. So we can also though see, I guess the best way to put this, like okay, I'm kind of stumbling over my words, but I want to say it this way. What I just described with the shrugs is what happens mostly if you have a bilateral contraction. What that means is both sides of the muscles are contracting. Now you could kind of like force it and you could definitely get the shrug with one side, but usually like this is where trapezius is really working, is when you're doing it with both sides. I want you to think though, what would happen if one side contracted? Again, you could also get this one side shrug, but another option is you could actually tilt the head to the side, right? We call this lateral flexion. So it really depends on, because you have two mobile ends, right? You have the scapula, which can come up, and you have the neck, which can bend. So it really depends on which side is stationary. So what can happen with this descending part is you can also get some lateral flexion, which is just going to be tilting your neck to the side. Okay, so that is the descending part of the trapezius. Now let's look at this middle or horizontal part. And as you can see, like its fibers are coming all the way over to that acromion, as well as the spine of the scapula and to that lateral third. And what it's going to do is it's going to yank on the scapula and perform what's called upward rotation. So this is a scapula again. So if we kind of like imagine this right here, what it's going to do, actually I did that, I did that wrong. This is what happens. That was actually downward rotation. This is what happens when you're looking at things backwards. So what will happen is it'll grab it and yank it like this. So when it is on top here and it grabs it, it's going to pull it. Now I want you to picture the humerus is right here. This is where the shoulder is going to be located. And so as it grabs it and yanks it like that, sure enough, that is going to be what we call upward rotation. You can think of this like a jumping jacks position. So as you're going up like this, the scapula is twisting on the rib cage, and then we call that action upward rotation. And now the middle part, or this horizontal part, can also get involved in elevation. It's going to help the descending part kind of lift the scapula up, but that is definitely going to be a big function. But we also have what's called retraction of the scapula. So retraction of the scapula, you could do this right now. You could just kind of like, it's kind of like it's like, think like a morning stretch, you know, you're just kind of like, oh, but what you're doing is you're slamming, you're pushing your scapulae together on the back. We call that retraction. So retraction of the scapula, you're just kind of squeezing them together. That is going to be these fibers here. And then we have the ascending part. So the ascending part is going to insert right here on the spine of the scapula. There's like this really interesting web-like tendon here called an aponeurosis. But this can also help with retraction, and it can even bring the scapula down. So it's kind of like, remember the depression? So depression is where you're bringing the scapula down. If you want to force it down, this lower head, or really the ascending fibers of the trapezius, can help grab onto it and bring it down. So pretty cool. So there's a lot of functions here for trapezius. Like I said, this is a very, very massive muscle. So let's now go ahead and take a quiz so we can see just how well this information is sticking in our brains. And I am going to do a custom quiz. This is one of my absolute favorite features we have here on Kenhub. Now, this is going to be part of a premium subscription, but I mean, this is a very powerful feature and it allows you just, I mean, as the name suggests, it's a custom quiz, a lot of customization in terms of what you want to be tested on. So I've gone ahead and already selected, just with these boxes here, just the trapezius. And so I navigated through the custom quiz and I decided to avoid some of the other muscles we haven't discussed, just so we can make this as streamlined as possible. So now that I have those, I'm going to come over and hit start quiz. This is also cool. You can decide or select, do you want to do a study session? Do you want to do an exam quiz? I want to do a study session quiz, so I'm going to go ahead and reduce the time frame to 5 minutes. And from there, I'm just going to click Start Quiz, and this is what we're going to do. All right, so what we can see is up here, it says, what is this? So this is going to be the trapezius. Obviously, that is what we are testing on. So what I want you to do is look at these options, and I want you to see if you can figure it out. I will give you just a minute or so. Not a minute, that'd be crazy. But I'm gonna give you a few seconds to see if you can figure out which part it is. So the answer to this is going to be the transverse part. But before I get there, I actually want to click on this little eye icon. And when I do, you can see that we can zoom in on this. You can get a better view of it, which is always awesome. You know, in my opinion, one of the best ways to learn anatomy is to just spend time looking at it. That sounds obvious. You're like, Justin, what else am I going to really do with it? But when I say look at it, it's more like really observing it, zooming in on things, looking at it in a lot of depth. You'd be surprised at how much you could just pick up by literally just looking at it. But again, this is going to be the transverse part of trapezius. All right, we're getting more complicated right off the bat. Ascending part of trapezius. So we can see there are different muscles here. Well, one large muscle. So I'm not going to discuss this right now, but I do want to show you. This is the latissimus dorsi. Latissimus dorsi is, its name literally translates to broad muscle of the back. Really cool muscle. We're going to have to do an entire video on just latissimus dorsi. But that is going to be latissimus. But we are looking for the ascending part of trapezius. So ascending part. I'll give you a moment. See if you can figure that out. The answer is going to be right here. Now, as I click on this, I'm actually going to go back because this is another cool aspect of the quizzes. You can go back and inspect things. And as I click on the eye icon, a lot of times people want to say this is the descending part because it's like it's going down, right? You get, or at least you get the feeling. But I want you to really look at the fibers. The fibers are beginning here and traveling up this way because remember, this is the origin of the muscle. So if this was the origin, then sure, this would be actually the descending part. But since the origin is on the midline, that means the fiber orientation is actually going up. So this is indeed the ascending part. I know it feels like the descending part, but it's the ascending part. All right, so what are the origins of the trapezius muscle? Ooh, I'm just gonna let you do it. See if you can figure this out. Take your time. You can pause the video, by the way. If you can pause the video, and if you need a little more time, and we'll see what you can do here. Okay, so what I want to do is read these a little closely. So internal occipital protuberance, superior nuchal line of the occipital bone, spinous processes of vertebrae C7 through T12, iliac crest, external occipital protuberance, and then the nuchal ligament. So the answer, so we can start with the nuchal ligament. And as you can see, we are highlighted in yellow here. That's to show you that there are more than one answer. So yellow is kind of just saying, hey, you've clicked something, but we're going to keep on going. Now, the next one is going to be the external occipital protuberance. So that is the bump in the back of the occiput, and then the nuchal line, or the nuchal ligament, I should say, the nuchal ligament is what is going to come off of it. Then the iliac crest, that is all the way down here. That's this portion here. So the answer is not going to involve the iliac crest. Spinous processes of vertebrae C7 through T12. Well, C7 is about right here. T12, and remember the spinous processes are that like posterior projection, so that seems like it would work. And then we have the superior nuchal line of the occipital bone. And if we look right here, there is that little line coming onto either side of the external occipital protuberance. We're going to go ahead and click that. And then the internal occipital protuberance. I want to discuss this because this is not involved with the answer. However, if they took the time to say external occipital protuberance, there's going to be an internal occipital protuberance as well. Otherwise, you just call it the occipital protuberance. This is kind of like a nice little thing to think about with anatomy. If they ever take the time to specify superior, inferior, anterior, posterior, those types of things tell you that there's a comparative structure on the other side. So let's check our answers and huzzah. All right. This will probably be the last one we can do. Now, I love these types of questions because what it has you do. So it says, what is this? You have to click on these in order to fill in the gaps. Now, what's fascinating about this is, I'm going to be real with you. Sometimes it can be a little tedious, but the more time you spend with it, the easier it gets. And I have seen success immediately with my students. So not just like understanding the back end of the science, of the psychology of how this type of studying helps. I've seen it with my very own students, where having to force your brain to spell out the word, which is exactly what we're about to do. So you can see we have the letters P-E-T-R-A and then Z-I-U-S. We're going to spell trapezius. And so you'll come in here, and boom, you get the muscle. And these will get progressively harder, and it just will be very, very helpful. And what's cool is, it saves your progress, and you can keep on coming back to this, and you can explore this, see how everything's going. Like, are you retaining this information? Again, custom quizzes are such a fun option. But if you don't want to do a custom quiz, what's cool is you can also go back to the article, and you will find a quiz that is embedded in the article as well. Now, those quizzes are typically going to encompass more than just that specific structure. However, that can still be fun to learn as well. But I hope you learned something fun in today's video. I know I had a blast doing this. It's always fun to explore the atlas and learn the anatomy from just a very visual standpoint. So be sure to let us know in the comments below for future videos what you'd like us to discuss. Again, I mentioned latissimus dorsi. We could discuss every muscle in the body. We could discuss every bone in the body. We could discuss anything in the body. So just be sure to let us know what you think would be valuable to you, and we will definitely do that in an upcoming video. As always, you gotta subscribe if you haven't. Leave another comment if you don't want to just say what we should do in the future. But we always love hearing from you. But I really got nothing else to add. I just want to say thank you for hanging out with me, and I'll see you in the next one.